Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes with your host, Dr. Rhiannon Winsor. Dr. Winsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she's spent her career helping clinicians and care teams optimize patient outcomes. You'll also hear from Bent Brayman, our media and graphics design producer here at the Exam Room podcast. Bent brings over a decade of experience producing multimedia content in the healthcare space, including work with major organizations like the Core Institute and the University of Phoenix. From video production to motion graphics and audio storytelling, he's the creative mind behind how this podcast looks, sounds, and feels. And when he joins the conversation, he brings a unique perspective grounded in both design and real-world healthcare experience. What makes a health center truly thrive? In this episode of the Exam Room podcast, Dr. Rhiannon Winsor is joined by Dr. Robert Babyar, Chief Medical Officer at Adelante Health Center, to talk about building a culture where mission comes first. From recruiting the right people to developing leadership at every level, Dr. Babyar shares how Adelante keeps staff engaged, patients cared for, and the mission front and center, no matter the challenges. We thoroughly enjoyed this conversation, and we're sure you will too. Let's get into it.
Welcome back to the Exam Room, where we probe today's healthcare challenges and dissect what's shaping the future of patient-centered healthcare. In today's conversation, we're flipping the script. Too often, the narratives focus on what's not working, and there's often a long list of things that health centers aren't getting right. But today, we're focusing on what health centers are doing right through the lens of Adelante Healthcare. To help me do this is today's guest, Dr. Robert Babyar, Chief Clinical Officer at Adelante Healthcare, where he's led with vision and compassion for nearly 9 years. A physician by training, Dr. Babyar also served as Adelante's interim CEO and was recently recognized as one of Phoenix Titan 100, honoring top C-suite leaders across industries. Thank you for joining us in the Exam Room, Dr. Babyar.
Thank you for having me today.
So first, I'm curious to know how one becomes recognized as one of Phoenix Titan 100. That's amazing.
Yes, so with a Phoenix Titan 100, as you mentioned, is a recognition for the top 100 C-suite members in the Phoenix area. There are Titan 100 organizations in about 8 or 9 other cities across the country. The process is to get nominated for the position, and then there are questions to answer about your leadership, what leadership means to you, what's been important, lessons learned, and then all of those applications are reviewed by a committee who then picks who those top 100 are. A majority of them are CEOs of organizations, but there are a number of other C-suite members that also make that ranking.
That's amazing. Congratulations.
Thank you.
So what inspired your journey from clinical practice into executive leadership of a health center?
Clinical practice is important. It's always important for your clinical leaders to have clinical practice as well. When I was in my residency, I served as chief resident. So that was my first kind of taste in how do we do those things? How do we be a part of making change? When I took my first job out of residency training in a community health center, I was one of the first docs in the organization outside of the medical director who joined committees and who acted on what we were doing and tried to have suggestions and ideas. At that point, the opportunity came at that organization. Our medical director was leaving for other reasons, and I was asked to take that role as the medical director for the organization, so I did. That was in 2003.
So how do you think your clinical background has shaped the way you lead at Adelante today?
When you're talking about leading a healthcare organization, you have to be able to balance the needs of the clinicians with the needs of the organization. So having the clinical background to understand the needs of the clinician allows you to translate what those needs of the organization are and bridge the gap between what needs to happen and what's expected to happen so that people understand why. It's always about the why. Why are we making this change? Why are we doing this? So having that clinical background allows me to learn some of the other elements and pieces, the business side of medicine, and grow and trust the leaders on the business side to act as that conduit between the clinicians and the administrative side.
For sure. I know when I was working in surgery, if as a surgical tech, if I was working with a surgeon that had started out as a surgical tech, that was a lot different dynamic, right? Because they're like, oh, we've been there. We know what you do. We know what you go through. And then I think there's more respect there, especially in the regard of what you do, where you're trying to be the bridge, right, between the two. So knowing both sides, being on both sides I can see where that really helps you be successful in what you do. So maybe I want to shift gears a little bit and talk about the culture of Adelante Healthcare. So can you start by sharing a bit about the overall culture of the organization?
Sure. We actually recently put the organization through a cultural transformation. We were reviewing our mission and our vision and our values and deciding we needed to make a change. And in most organizations, that change comes from the top down. The board of directors and the executive team come up with the idea, the mission, the vision, the values, and then send that down. We put together a group of about 25 or 30 employees across all of the organization, and they met and they talked about, what do we want our vision to be? What do we want our mission to be? And what are the values? What ones did we have that we might keep, and what ones did we decide to change? And that we rolled out at the beginning of 2024. It's about respect, compassion, being present for our patients, being present in the community, and that's the culture that we're trying to foster at Adelante Healthcare. We're all in this together. It's a team sport. How do we work together with all of the knowledge we have in our areas to collaborate with all of the knowledge everybody else has in theirs to make that patient experience what it needs to be and to be able to provide high-level care when we're talking about what we want to do.
I love that, and I think that definitely creates more buy-in across the company as well.
There were intense discussions about the words in the mission, the words in the vision, and how they related to where we started as a company and how they relate to what we're doing today.
It makes me think of when I worked for Pima Medical Institute, their org chart was actually flipped upside down. So the students were at the top of the chart and then the CEO is at the bottom. Yep. And they established that mindset when you come on board, right? That's one of the first things that, they tell you and they share with you, like the student is at the top of our org chart and we're all underneath them to support them.
Right.
With your approach to having a large group of different employees from all parts of the company, do you see that collaboration breed more enthusiasm for the things that your folks are doing?
I believe that it does. It's about breaking down the silos, the areas where this is my area and I'm doing this, and this is my area and I'm doing that, and where they meet together. You don't always get then that clashing of meeting. It's a melding of how do these things have to work together. So I believe that piece, by getting buy-in and engagement with our staff, is the right way to go.
Absolutely. And then also modeling the behavior, right? Because you can't just come in and be like, oh, well, you're going to act like this or you're going to do this. I don't think you're going to gain respect and trust unless you're modeling that behavior yourself.
Correct. It's about connecting and recognizing that people are there. The biggest thing I see in organizations are they forget about the good performers because they're doing what they're expected to do. So they get kind of forgotten until all of a sudden they're not there because they've been forgotten. How do you as a leader make the effort to acknowledge and recognize the value and contribution of everybody in the organization? And that's what we strive to do.
So it sounds like there are a lot of successes and a lot of wins. There's a lot of things that you're doing right. What are some of the top things, maybe the top 3 successes?
In this last year, it's been about service. It's been about providing services. In the last year, we've opened up 2 on-site pharmacies at 2 of our locations. We've made that work for our other locations by putting in a mail order or a delivery service so that our providers at our Mesa office, for example, can send their prescription to our pharmacy in Goodyear, and then that will get delivered to them at their request. Some patients go pick their scripts up, right? We have pharmacies now in our Goodyear office and in our Surprise office. We would love to expand more through the next couple of years, partly because the way that our patients can get their discounted medications has altered somewhat. Our organization participates in what's called the 340B drug discount program, which is a federal program open to community health centers, Ryan White clinics, critical access hospitals, rural hospitals, and some other groups across the country. It allows those groups to purchase their medications at the lowest price, the government negotiated price, which is usually the lowest one that's available. What that means is we're able to bring the medication in at a price. The insurance still pays us for the medication as they would on any other agreement. And since our price is low, that gives us an opportunity to have funding to roll back into our programs. If our patients are on our sliding fee discount, then they're able to pay cost of the meds. And at times, depending upon the manufacturer and the medication, that can be dollars per prescription. For stuff that would normally cost maybe $100, we might be able to get it to them for $8 or $10. And that really helps those people to take the meds that they need to take.
So this might be a silly question, but how is that, the need for that assessed?
Any person who's a patient at Adelante Healthcare is eligible for that program. As a pharmacy, we will still run them through their insurance and go through that process, but then everybody's eligible for whatever discounts are available. We have added with our own pharmacy drug assistance program for copays. So some people who may have Blue Cross insurance still have a high copay that they may or may not be able to afford. So we will then get them on a copay or prescription assistance program to still bring that price down for them even more.
Nice. So that's automatically kind of built in.
Correct.
That's really nice, because that, I could see where that conversation could be really difficult for the patient to say, it's great that you prescribed this for me and I know that it's going to help me, but I don't have the money to get that prescription, or
right.
Something along those lines.
And that affects like adherence too, like where people can get really sick because of that barrier.
It does. When patients are deciding between picking up their prescription and putting food on the table, or paying their rent, or paying their electric bill, or getting their kids' school supplies, right? Those are real life conversations that they're having. How can we provide the medical service they need to be healthy to do all those other things that they need to do?
Yes, in a way that's sustainable for the health center as well.
Correct.
So that sounds like a big win. What are some other things?
Yes, pharmacy has been a big win. Over the last 3 or 4 years, we have been expanding our behavioral health program. So 2 pieces and arms to our behavioral health program. One is our integrated behavioral health program, where we have behavioral health consultants working shoulder to shoulder with our medical providers in the exam room, providing those patients not only with behavioral health interventions for the common things we talk about of anxiety and depression, but also helping them with motivational interviewing, cognitive behavioral therapy for, I'm afraid to take insulin because I don't like needles. Well, let's talk about the why that is. I can't get my medication, or I'm not remembering to take my medication. Why is that? And having that behavioral health consultant give them tools to be able to improve their medical conditions. Not always about a behavioral health condition. Their focus is on the medical condition of the patient. We have also expanded the opportunity where at times they may refer, our provider may refer to that integrated behavioral health specialist and realize they need therapy. or they need to see a psychiatrist to further delineate and define what they need. So we've been expanding our behavioral health specialty side, which includes therapists, as well as psychiatrists and psychiatric nurse practitioners, to provide that medication management service for our patients that are beyond simple depression that your primary care provider can manage and prescribe for.
That's huge, because I think a lot of times when you have like, especially like a chronic condition, that can feed into like depression and anxiety, and like it's a way more holistic view of your patients. So I think that's wonderful that you're expanding it into that.
And that's correct. When we look at our program and we evaluate how many patients are there, where are we at, what is the need, we are scheduling almost 200 intake appointments a week for patients that need specialty behavioral health services. We're probably doing anywhere from 120 to 140 patients. As with anything, they might not show up. They might decide, oh, I humored them and said I needed it, but I really don't think I need it, so I'm not going to. But we're making every effort. But when you talk about 140 patients a week, that fills up 2 therapists' schedules for the next 10 weeks, 12 weeks, while they're giving them therapy on a weekly or biweekly basis. And that's only a 13% penetration into our total population. So we know in primary care, the statistics are out there that say 60 to 65% of patients who go to their primary care provider's office have an either undiagnosed or untreated psychiatric or behavioral medical condition. 65% of our patients should be seeing the specialty behavioral health program, and we have that up to about 13 or 14% right now. Some of it is capacity on our side with how many therapists we have. Some of it is still the stigma of mental health and behavioral health issues and people not wanting to admit that they're getting therapy or seek out that therapy. But it has been a big win for our patients and for our organization to give us the opportunity to help take care of those patients.
And that ties into population health too. Like when you're able to like address not just the physical maladies, but like you're addressing things that are very heavy and kind of hard for people to even admit to, let alone like take that first step to getting treatment for those things. And I just know from personal experience, like when there's like depression present, like it affects families, it affects like the way that you work. When you are able to take care of those things, in addition to taking care of somebody's physical health, that almost like brightens all of that and takes some of that heaviness away.
That's true. That's very true. You know, one of the things most people recognize, whether it's been dramatized in our culture or social media, that what severe depression looks like. I can't get out of bed. I have no motivation. I don't want to do these things. And those are ones that are like, yeah, they really need something. But you have people who are going about their daily life every day that are not happy, that are disappointed, that are struggling with what am I doing? Why am I doing it? What's my reason? Right? And it doesn't show. It's not a physical malady that we can see and recognize. So we screen all of our patients that come in for depression, anxiety. We do some standard screens across the board to try and help us identify those patients that could use a little bit of that integrated intervention for their medical visit, or that maybe need that next level, that higher level of therapy and psychiatric care.
I think that's so important. I was talking with one of my friends, and she was mentioning that she had a visit with her primary care, and the MA asked her, do you have any signs of depression? And she said, well, I've been going to grief counseling. And she's like, okay. And that was the end of the conversation. It's really promising, you know, that we might not be capturing everyone, but we're starting to think about mental health and how it correlates with physical health. And I think that's really important.
Absolutely. I agree with that.
Yeah. Any other successes that you want to share?
Oh, goodness. Well, we recently opened a new location on the campus of the Arizona Center for the Blind and Visually Impaired. Grand opening will occur later with all the pomp and circumstance that grand openings require, but that we opened about 3 weeks ago at that location with a focus on serving that Arizona Center for the Blind and Visually Impaired patient population. These are adults who have become blind due to accident or illness. So they weren't born blind and they weren't blind at a young age. They were developed it as an adult. And the struggles that they have to navigate the healthcare system, to get to a doctor's office and then have to go get a prescription somewhere, and they have to have people take them and give them a ride, and they have to call for Ubers and Lyfts and even the stuff that is through their insurance that allows them to do that stuff, where if they're not there at the right time or they're running behind, the ride goes, right? So how do we do that? It started with a opportunity to talk with the leader administrator there, and we were working with them to bring their patients to one of our sites for care. That was how it started. They had money to pay for their health care and they wanted to have us work with them. And the providers and the administrator at that site just loved working with the patient population. And we talked about what can we do. And they had space on their campus that had previously been destroyed by fire that they were renovating. And they had an idea, along with us, of, well, maybe we can put a clinic here. So instead of even them having to take their clients and put them in a van and bring them to us, they just need somebody to walk them down the sidewalk to come in and get and access that health care. And we're working on all the bugs and the quirks as we go with a new venture about how to get them their medications, how to get the prescriptions sent to our pharmacy and then have those medications delivered on site. Ideally same day, but definitely by the next day, so then they don't have to navigate that piece of the system of going out to a pharmacy and doing all those things. The things that the Arizona Center for the Blind and Visually Impaired are doing are incredible, and they've given people back the opportunity to live in a mostly independent way, teaching them the skills to cook, teaching them the skills to apply for a job, teaching them crafts to do. They had one of their members' clients had developed a recording studio on their site. It was their passion was music, and they have a band. I can't, the name is clever, but I can't remember the name of their band, but they have a band, a group of their clients that play instruments, and they put that together as a band. So giving them the opportunity to feel a part of the community and giving them the resources by having healthcare right there was important for us.
That is amazing. Congratulations.
Thank you.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.